Guys, it's your boy Waffles. Put some syrup on that. Today I'm gonna be talking about something that happened recently. But before I say that, I gotta apologize, guys, for not uploading for the last couple days. So basically, the reason why I haven't uploaded for the last couple days and what I'm gonna be talking about today is I had oral surgery. So if you guys don't know what oral surgery is, it basically translates to teeth surgery. So either getting teeth implanted, like fake teeth, or getting them pulled out. Now I had 3 of my teeth pulled out. My 2 bottom first molars and my top right up here, second molar. So I'm gonna be talking about my experience of having that done to me today. So yeah, basically first I'm gonna start off with how I was feeling. So I was feeling actually pretty excited because I got IV sedation, which we'll talk about later, and that's basically just like they put a needle in your arm and it makes you go to sleep so you don't feel anything. And I was pretty excited to get it because yeah, I never had that before, obviously, and I was just kind of like excited because you actually go to sleep during it, and it's kind of like crazy. I just think it's really cool how they can develop that. So basically, I was feeling pretty excited, but then when we got up in the morning, I had to go pretty early because you're not allowed to eat for 6 hours before the procedure. So we decided to like go at like 7, be there by 7:45 so I could just sleep, like, cause the hour that I slept is like enough, like over 6 hours, so I could eat like until like I went to bed. So yeah, basically in the morning when I got up, I was kind of nervous, but I remember to think about like how excited I was yesterday or on Thanksgiving, I guess you could say, about my procedure. So we drove there. Obviously, it's Momenta. It's just called Momenta. So when we got there, I was pretty nervous but pretty excited. Yeah, we just sat in the lobby, and then the doctor came and got us. And basically, he brought us in the room, and he kind of asked me. He asked me how much I weighed because, if they need to they need to weigh you, or they need to know your weight to give you the right amount of dosage of the IV sedation. So then once that happened, they had a monitor which monitored my heart rate and I think my blood pressure, and that's just in case my heart rate started going crazy and they needed to take me off it, because not everyone has the greatest reaction to IV sedation, but it's very like it's like 1/8% chance to die. So like one in like 10 or 12 million. So it's really safe. And yeah, so they put a couple patches on my chest that kind of monitor my heart rate, and then they put a tube, kind of, like a blood pressure thing that goes around your arm that kind of like tenses up. They put that on my arm. They put a little thing on my finger to test some other kind of blood rate thing. They also put some tubes in my nose. I don't know why they did that, but yeah, it's kind of like goes around your head, and then there's like tubes that go in your nose. And yeah, that was basically it. But then so what happened was they took a needle, and I don't know if you guys can see this, but they put it in my arm right there. You might be able to see if there's like a red. You might be able to see like a red dot on my arm. Here, guys, let me try to show you. You might be able to see like a red. Yeah, see that little red dot in my arm crease there? They put the needle in right there, and it actually hurt less than a flu shot, so I was very happy about that. And then what they did was they got another needle. So there was a tube attached to the first needle they put on my arm. They got another needle and attached the tube to their second needle. Then they put in some of the IV sedation fluid. And what IV sedation fluid is, it's basically knocks you out, like not instantly, but within like 10-12 seconds. So it basically like makes you like get knocked out, so you're just completely unconscious while you're doing a procedure, so you don't feel anything. And yeah, it worked really well. Within I think 10-20 seconds, I was just you don't even feel like you're sleepy. You just feel kind of like whoa, like weird, and then it's just like what, and then you're so basically. Yeah, you just wake up like immediately. So basically, it felt like less than a second to me that I was actually asleep, but in reality, it was about 45 minutes. And my teeth were pulled out, and my lip was insanely swollen on the bottom because they had given me some Novocaine in my gums, which basically just numbs the area. Why they did that, you guys might be questioning, because they already gave me IV sedation, so why would I feel anything? It's for the after procedure, so that my teeth don't hurt after. They wanted to numb me, because if I woke up and they had just done the procedure, it hurt pretty bad. Now, yeah, my mom wanted to keep my teeth because I don't know why. It's weird. I don't know. But anyway. So yeah, basically I had the procedure done, and after that, I was kind of, yeah, if you ever see those videos about people like who were like, oh, after they get their wisdom teeth out. So I had the same exact thing, but I didn't get my wisdom teeth out. I just got a couple teeth out, and we'll talk about why I got them out later. But yeah, I just got a couple teeth out. So I was actually affected by it. I was like, oh. So when I got home, I was like crying because I couldn't control my emotions because I was like drugged up basically, and then I was like laughing, and then I would cry, and then I would laugh, and I couldn't drink water because my lip was numb. So imagine like not being able to feel your mouth while you're trying to put something on it. So if the glass touches your lip, you can't even feel it. So it's like I didn't know where my mouth was, and I was just like spilling it. And yeah, it was pretty crazy. My teeth hurt pretty bad, so I had to eat mostly fluids because there's kind of holes where they took all my teeth, and I don't want any food they don't want any food to get stuck in there because it could infect it. And also, they did stitch up my gums, like where they took out the teeth because they were kind of ripped apart. But yeah, I'm not gonna get too nasty. So yeah, that's probably about as far as I go. I did get like a so basically the two teeth down here, they don't have any adult teeth below them, so they were still my baby teeth. So when I'm around 20, I'm gonna get implants in those spots right there. So that, but they're gonna be fake teeth, but they're gonna be very nice. And then my upper like one right here that has an adult tooth above it, but it was my baby tooth was already loose, so they were like, why not just pull it out? So they pulled it out and they attached a little chain that goes onto one of my braces. You guys know I have braces, and then it also connects to my adult tooth that is coming in from that baby tooth they pulled up here, so it'll slowly pull it down. Yeah, that was basically it. But I gotta tell you guys, so why they had to remove these teeth is because first of all they were baby teeth. Second of all, they were like some of my teeth, most of my molars are here, and then these guys were like down there, and then my other molars were here. So it's very hard to clean them because there was like a big gap here with just a little tiny short tooth. So I took them out because it could also stunt my jaw growth. It could also stunt my jaw growth because sorry guys, because yeah, go watch Chug Challenge 3. There's a lot more of those. But yeah, basically, I took them out because it could stunt my jaw growth because the tooth. So when the baby tooth, they don't want the baby tooth to get. So it basically the tooth that your body knows it's gonna have forever has very long roots. So when I took out my teeth, you know how you see in the cartoons where there's like the tooth and then there's like these two long roots that come down. That's actually how my teeth look. Because even though they're baby teeth usually don't have any roots. Do you guys know if you've lost any teeth, they usually are just kind of flat on the bottom. But since these are baby teeth, but there were no adult teeth under them, they had huge roots which went into my jaw, which actually connected to my jaw, which is fine. But it's gonna stunt my jaw growth because the teeth aren't far up enough. It's kind of hard to explain, but they're not far up enough for the jaw to actually expand. So they took them out, and I'm going to get implants that are perfectly normal, and they're going to drill them into my face when I'm 20, so it'll be in there for good. And yeah, that's basically it, guys. I just wanted to explain how IV sedation is and what happened to me and why I haven't uploaded in the last couple of days is because I was basically, first of all, I was like drugged up, so I was kind of weird. And then second of all, my teeth hurt really badly. But if you guys take some Advil solves the problem, guys. Advil. Okay, but yeah, Advil works really well. But yeah, also, if I had to rate it on a pain level, like before, like as they were doing the procedure, I'd say half of 1, because this shot, like I could feel it, but it didn't. It was kind of like if you like pinch someone, but like not hard, just like kind of like that, like just like it like. I mean, on a scale of 1 to 10, how much it hurt, I probably hurt like a 1. So it was like if someone like that, and that's like how it hurt. So yeah, it was probably like half of 1. I guess I'll just say 1 out of 10. So 1 meaning like the least painful, and 10 meaning the most. I'd say 1 out of 10 for the entire procedure. They did a great job. Momenta is really cool. So if you guys need teeth surgery or oral surgery, you may go to Momenta because they're very good. Momenta. That's basically it, guys. I was bleeding a little bit after the procedure. I had to wear some gauze in my teeth holes because I was bleeding. But that was basically it, guys. So if you guys want me to upload more about this or show you guys my teeth that were pulled, which is kind of weird, please say you want that in the comments. But otherwise, please like this video because I had to go through a lot of pain. I mean, not a lot, as you can see, I rated it 1 out of 10. But it was kind of stressful because, like, I didn't know how much it was going to hurt. And yeah, and please subscribe if you haven't already because I make great videos. Please go check out Chug Challenge 3. So as you guys know, I said if it gets 150 views, I do Chug Challenge 4. It only has like 50 views. So I don't know why, because Chug Challenge 2 is like over 150. So please go check out Chug Challenge 3, guys, and maybe like it and just view it. Yeah, it's actually insane. Chug Challenge 2, I'm chugging 2 LaCroix. Chug Challenge 3, I'm doing 3. So you guys gotta go check it out. That's the entire video for today, guys. I'll probably be uploading tomorrow. I'm not really sure what about. If you guys want to see more Among Us or even more Minecraft, comment down below Among Us or Minecraft. And yeah, that's the entire video, guys. Your Waffles is out.